What are some of the health issues that are caused by uncontrolled diabetes? I know we talked about the feet. What else is there that I know there's several? So if you could maybe touch and explain a little bit about those.
Absolutely. Just to list them real quick, the major ones. Heart disease is increased, so people have more heart attacks, and of course the effects from that. Strokes, eye disease, kidney disease, and higher infections. If I were to pick the top five, I would say that.
Okay.
Most of these, or all of these, I think, Cindy, stem from a higher blockage of blood vessels. So the reason we have higher infections is because the circulation is not as good, and there's not a lot of healing, right? That's why people sometimes unfortunately lose their feet because they get a wound and they don't know that it's there, right? And that's why people need to check their feet every day. But what is also bad is when we get to it and see the wound and we try to give them medicine, they just don't heal as well. So now you have an infection that you cannot treat, and that's spreading. And if it's bad enough, the only option would be is to cut that, limb off or that toe off or whatnot. And we probably both know people that have had that.
Right.
It's very sad.
Right.
But the other, the heart disease, the strokes, the kidney disease, the eye disease are things that when you're a diabetic, we have to be a little bit more aggressive. For example, cholesterol needs to be a little bit lower in people with diabetes than people without diabetes, right? We have to go to the eye doctor once a year to make sure that we're not getting damaged. We have to check your kidneys with blood work or with urine testing or both to make sure if it starts happening to catch it early and treat it.
Okay.
Absolutely.
Okay. Just for those of you, when it comes to checking your feet, if it's hard for you to do, what I do is my husband checks my feet for me almost daily. Somebody that you don't, if you don't have a spouse, but somebody, a parent, a child, somebody to check your feet every day, I think is really important because I don't want to lose my feet. So I do it. But now let me ask you, if I keep my blood sugar under control, does that stop the chance of that happening, or does it just minimize the chance of that happening?
Good question. One of my professors in medical school, I remember him to this day. He always told his patients, and I tell my patients, basically what he said is, if you control your blood sugar, you're going to live a normal life. You won't have any problems. You won't have any issues. It's almost as if you don't have diabetes, other than you have to take care of your diabetes. Right. So if you've been a diabetic for 10 years and you've ignored the symptoms and whatnot, well, basically there's not much to do there. That period of time where you just didn't know the damage has happened. But once you find out you're diabetic, from there on out for the rest of your life, if your blood sugar is controlled well, you really should not have any problems. Now, having said that, in reality, most people are unable to control it all the time. I mean, that's our goal, and that's what we want to aim for. And to the degree that you control it well, you won't have any problems. So for all intensive purposes, if you're able to control it, and if you have adjusted your life and your priorities to control it well, you are going to live an almost normal life compared to a non-diabetic.
Okay. That's good to know.
Right.
I think that when we're diagnosed as diabetics, I know what words came out of your mouth that I'm a diabetic. First thing I did was I cried. And because to me, I thought it was a death sentence.
Right.
And the education of knowing that that's not the case, and it doesn't have to be, is liberating.
Right.
And so thank you for that.